Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Doctor. Good morning.
Yes, good morning. What's your problem?
Well, Doctor, I have a sinus problem. I get post-nasal drainage, facial pain, headaches, sore throat and congestion.
Since how many days have you been facing this problem?
For the past 2 weeks, Doctor. I'm also getting snoring, teeth pain and nasal burning.
Is it moderate or severe?
It worsens in the evening and morning.
What's your age?
47, Doctor.
Did you have any illness previously or any surgeries?
Yes, surgeries, gallbladder and hernia.
Do you drink, smoke?
I don't drink, but I smoke 1 pack of cigarettes per day for the past 15 years.
Any of your family members have any illness?
Yes, I have a family history of allergies and hypertension.
What are the medications you are taking?
Claritin, Dilantin and Rhinocort nasal spray.
Are you allergic to any medicine?
No, Doctor.
Well, your auricle's external auditory canals reveal no significant abnormalities bilaterally. TM's intact with no middle ear effusion and are mobile to insufflation. Your intranasal exam reveals moderate congestion and purulent mucus. Your oropharynx examination shows teeth, alveolar ridges reveal missing molar. Examination of the posterior pharynx show a prominent uvulva and prominent postnasal drainage. The palatine tonsils are 2+ and cryptic. The palpation of anterior neck reveals no tenderness. Examination of the posterior neck shows mild tenderness to palpation of the suboccipital muscles. Facial examination shows there is bilateral maxillary sinus tenderness to palpation. Waters View X-ray reveals bilateral maxillary mucosal thickening. You have acute maxillary sinusitis, 461.0. Snoring, 786.09. Well, I am prescribing you Augmentin, 875 milligrams twice a day, and Mucofen, 800 milligrams twice a day. Follow these medications for 3 weeks and meet me after that. If the conditions don't improve, then I will order a mini sinus CT.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, I'm having asthma and facing difficulty in walking even 10 steps. My weight is 344 pounds. I have high cholesterol and high blood pressure. I have joint pain, back pain, foot and ankle pain, and swelling on my leg and foot. I have sleep apnea and snoring. Moreover, I am a diabetic patient on medication. I also have hemorrhoids, doctor. I am also pursuing surgical attempts for weight loss and to become active in my life again.
What's your age?
37, doctor.
Okay, do you drink or smoke?
I do smoke, and I have stopped drinking alcohol a year back.
Have you undergone any surgeries earlier?
I underwent orthopedic knee surgery, doctor.
Can you brief me about your family history of diseases?
All my family members have obesity, heart disease, and diabetes, and negative for hypertension and stroke. But I am using Chantix to come off smoking completely.
Okay, tell me about your food habits.
I eat things like bacon, eggs, and cheese, cheeseburgers, fast food.
How many times do you eat in a day?
I eat 4 times a day, 7 in the morning, at noon, 9 p.m., and 2 a.m.
Well, the ideal weight for your age is 184 pounds, and you are weighing 344 pounds. That means 184 pounds in excess. What medications are you taking?
Diovan, Crestor, and Tricor.
Do you have any chest pains or any mild attacks?
No, doctor.
Well, your cranial nerves 2 through 12 are intact. Neck is soft and supple. You have positive wheezing bilaterally. Heart rhythm is normal. Abdomen is soft. You have 1+ pitting edema. I have reviewed your complete test reports. This is a clear case of bariatrics, and you need to go for a laparoscopic Roux-en-Y gastric bypass. The complications include infection, bleeding, pulmonary embolism, deep venous thrombosis, leakage from the gastrojejunal, anastomosis, and possible bowel obstruction. Before we proceed for the surgery, you need to get reports on upper endoscopy, H. pylori testing, thyroid function tests, LFTs, glycosylated hemoglobin, and fasting blood sugar.
Okay, doctor. I would like to proceed with the surgery.